There is no safe level of lead in children, and each year, hundreds of New Jersey children are diagnosed with lead poisoning. Now, a new report says the state could save $27 billion a year by preventing lead poisoning in the first place. NJN News health and medical correspondent Sarah Lee Kessler has the story.
This is the main source of lead poisoning. Lead dust from peeling lead-based paint. Children under the age of 6 whose brains are rapidly developing are most at risk, primarily because they can't keep their hands or objects out of their mouths.
So every time the child puts their fingers near their mouths or eats anything that has the dust on it, they're getting lead into their system.
There is no safe level of lead in a child's body. Even at very low levels, 1 or 2 micrograms per deciliter, it can result in cognitive impairment, neurological damage, all sorts of negative effects.
Jean Riley is the deputy director of the New Jersey Public Advocate's Office. She says a new report commissioned by her department concludes that preventing childhood lead poisoning would save New Jersey $27 billion.
In terms of increased taxes and reduced revenues that are lost.
Lead exposure can cause permanent damage to the parts of the brain that regulate a child's intellect and self-control. The net result, according to the report, poor performance in school and a greater likelihood of antisocial behavior.
Lead exposure has a direct effect on crime, aggressive tendencies, violent crimes in children. So there's a cost to society right there. And lead also reduces IQ, even at very low levels.
In New Jersey, children are tested for lead exposure at age 1 and again at age 2. A blood test of 20 micrograms per deciliter triggers environmental intervention, which can include extensive remediation. But Health Commissioner Heather Howard has proposed reducing the action level to 10 micrograms.
Negative, less than 1.
We're saying that any exposure to lead can threaten a young child's developing brain, and so we want to be more aggressive in our intervention.
The state health department also wants to test pregnant women whose kids have tested positive for lead exposure. Sarah Lee Kessler, NJN News, Newark.